Hi, I'm Bianca Castro with NBC5 Health Connection. We'd like to share with you some of our recent stories that feature your Medical City healthcare doctors, staff, and patients. Right now, 1 in every 4 deaths is linked to heart disease. One North Texas woman who survived full cardiac arrest is now sharing her story and the importance of heart health. Here's NBC5's Evan Anderson.
I can do all things through Christ who strengthens me. Yes.
Patricia Mims says her life today is nothing short of a miracle.
Every year I celebrate my survival each year. So because I know I was out of here.
In April of 2009, her life would change in an instant. Patricia was at work in Fort Worth when suddenly she knew something wasn't right.
And then all of a sudden, my heart, it made a sound like cloop. It just like jerked and I felt it in my chest and I was at my desk and I thought, whoa.
She left work early that day and amazingly made it back home.
It was just sweat like everywhere, just all over her body, just running down her forehead. She was just drenched in sweat.
Patricia's daughter, Brooke, 14 at the time, was just home from school and says out of nowhere, her mother collapsed.
She just fell out. Like literally her whole body went limp and she just like collapsed like right in front of me.
I had a sudden cardiac arrest and I dropped to the floor and they say I was dead.
Her heart stopped beating for nearly 2 minutes. Brooke and her brother, Brandon, frantically tried to get their mother help.
Like I knew like instantly that she was like gone.
Women usually don't survive. They don't come back from that when you drop.
But she did and was completely unaware that she had just collapsed.
In fact, she did die. I mean, when you have cardiac arrest, for whatever reason, your heart is stopping.
Cardiologist Dr. Del Yu says cardiac arrest is quite common. There are more than 500,000 deaths a year in the U.S. alone, and survival is low.
It is actually the most common cause of death. It is more than all other causes of death, including cancer, specifically breast cancer.
At 46, Patricia was diagnosed with cardiomyopathy and now has what's called an ICD, or an implantable cardioverter defibrillator, implanted in her chest.
Yes, I rejoice. I rejoice in the Lord greatly. I am a walking miracle. I know I am.
Dr. Yu says he's seeing more young patients, even teenagers, with cardiomyopathy, and that's why he says early heart exams are very important. We are keeping a close watch on this year's flu season, and now is a good reminder to know about how Medical City Healthcare's freestanding emergency departments can serve your healthcare needs. The waits are often a lot shorter, and that can be crucial for getting quick, life-saving treatment for serious flu complications like pneumonia. And since it's an extension of the larger hospital system, they can quickly send very ill patients to the hospital.
Many of our hospitals get significantly overcrowded this time of year, and so it is nice to have those convenient access points.
If your child has the flu, here are the signs to look for to signal a trip to the ER. Rapid breathing, bluish skin color, especially in the face, difficulty or unable to wake your child up, severe irritability, your child doesn't want to be held, stiff neck, and a severe headache that does not improve after taking pain reliever. We hope you enjoy these Medical City Healthcare headlines, and thank you for watching NBC5 Health Connection, weekdays at 5.
NBC5 Health Connection is brought to you by Medical City Healthcare.